Today we're going to be talking about the muscular system, specifically the axial and appendicular muscles for Chapter 11 for the Anatomy and Physiology text, McKinley, O'Loughlin, and Beidel. And we're going to start off the back with a little bit of review, or reminders, I should say, for what we're specifically talking about between the axial and the appendicular muscles. The axial muscles, as a reminder, some of the content was in Chapter 10. Axial muscles have both origins and insertions. Muscles always begin at the origin and they insert into a given point or multiple points, multiple origins or singular origins or insertions related to the axial skeleton in this case. They support, these muscles support and move the head and the vertebral column, basically the head and the spine. Basically the spine itself, and then that, generally speaking, and may play some roles with the head. They function in facial expression, breathing, chewing, and swallowing, and they support and protect the abdominal and pelvic organs. The appendicular muscles, they control movements of the upper and lower limbs, the appendages, and they control movements of the pectoral and pelvic girdles. Pectoral, remember, also referring to shoulder girdle being synonymous or typically often a reference used as well, more so than typically than pectoral outside of the medical and biology references. Organized groups are based on locations with the appendicular muscles. And looking at the actual locations here, I'm not going to go over them in detail here because it's something you're going to be doing in lab and something you'll have to do repetitively for making sure that you know the given locations that are going to be required for your lab. I will provide you with worksheets if you need them. Just let me know if you'd like blank worksheets, if you already have that available to you. Having these similar diagrams with blanks so you can actually use them for practice over and over again. Having a key, of course, to look at, and then going back and forth until you finally can get them all, or all the ones that you're going to need to know specifically once that's been clear for you in lab. But I'm otherwise not going to go point for point all the way through this. That'll be saved a little more for lab preparation and lab time. And the same with the posterior view. For the first section here, beyond that, you need to be able to compare and contrast the superior or proximal and inferior or distal attachments of a skeletal muscle, describe and differentiate between the organizational patterns and muscle fascicles, and differentiate between agonists, antagonists, and synergists. So muscle attachments. Tendons, they attach the muscle to the bone, to skin, or another muscle. That being said, it's typically more muscle to bone, generally speaking. An aponeurosis is a thin, flattened, sheet-like tendon. They obviously are more, we're talking about, related to tissue, as opposed to muscle to bone. Now, most muscles cross at least one mobile joint. Upon contraction, one bone moves while another is fixed. Generally speaking, from a standpoint of what a muscle can do, there are situations where you may have more than one being moved by a given muscle, but generally speaking, we're talking about when there's one mobile joint, it's always one bone's being pulled toward another. It's always a pulling action, right? For the origin is always the point that is fixed, so to speak, from where the muscle begins, and then wherever it inserts and attaches, that attachment point is pulled toward the origin or origins or insertion points. The attachments for the axial muscles, there's a superior attachment that's usually more movable, and the inferior attachment usually less movable. Attachments for the appendicular muscles, the proximal attachments usually less movable, and the distal attachments usually more movable. What they're really referring to in here in that situation is the beginning is going to be the origin, wherever it goes to is going to be the insertion. And you'll know where the origin is because the direction of the muscle always pulls toward the origin. Proximal attachments of the biceps brachii are on the scapula. They're basically the proximal attachment here, origin there at the scapula. The distal attachment of the biceps brachii is on the radius. That's the insertion point specifically here. Now we're talking the biceps brachii. There's more than one biceps muscle, right? The biceps brachii, so in other words, the insertion is here at the radius, and the actually you have two attachment points. You have basically the humeral head here, and you also have basically the proximal head. And then you also have at the scapula as well, those are your origins, more than one origin here, okay, for basically pulling that forearm then toward the humerus for what would be the concentric action of a bicep, basically something called arm curl or bicep curl, but it's technically elbow flexion. In elbow flexion, you'd be basically bringing the forearm toward the humerus, which is what the bicep does. And of course, it's technically involved in some rotation as well, technically supination as well. It's not just flexion. As far as organizational patterns of skeletal muscle fibers, there are varied organization of fascicles that are bundles of muscle fibers. Remember, myofibril is a muscle cell, muscle fiber, same thing. And then fascicles are bundles of these. The circular muscles are concentrically arranged fascicles. They create a sphincter. They control material passage through an opening. The parallel muscles are fascicles that run parallel to the muscle's long axis. Sometimes they have an expanded central belly with high endurance. The convergent muscles are fascicles that merge toward a common attachment site. They can pull in varying directions, but not as hard as the parallel muscles can. And then pennate muscles are fascicles that are organized as if part of a large feather. The fibers pull at an angle to the tendon, and they generate more tension, but they don't pull their tendons as far as parallel muscles do. Three subtypes are unipennate, bipennate, and multipennate. So we have a circular orbicularis, oris, and we have parallel, the rectus abdominis for the abdominal region, which technically is a flexor of the spine. Convergent, we have pectoralis major, and the pectoralis major basically horizontally adducts the humerus across the body, plays some role in internal rotation as well, also known as medial rotation. And unipennate, we have the extensor digitorum, which is a much smaller muscle that we're not playing as much of a role with. We're not talking about as much detail here. The bipennate example, rectus femoris, is basically one of your quadricep muscles, primary job being to extend the knee. And then we have our multipennate deltoid. Technically three heads, the anterior, the middle or lateral head, and the posterior head, all of which play a role in movement of the shoulder. And the anterior head being more towards flexion, and the middle or lateral head being more towards abduction out to your side, and the posterior head being a little bit more toward basically either extension or toward horizontal abduction. Technically more extension and in horizontal abduction, that'd be fair. Oop. And then as far as actions, muscles are grouped by primary actions. An agonist is also referred to as a prime mover, the muscle that contracts to produce the movement. The triceps brachii is the agonist for the forearm extension. In other words, the forearm, you're straightening out your elbow, your forearm is closer to your humerus. As it moves away and goes into extension, the triceps perform that action, whereas the biceps perform the opposing action. In the situation where you're going into elbow extension, where the triceps do the work, they are the agonist. Agonist's work is being done by the triceps, whereas the antagonist is going to be the biceps. The job of the antagonist, by the way, is to not do anything, is to allow the action. Because the antagonist tries to do work, the antagonist becomes an agonist. If that happens, then we have restricted motion. Now, if we're talking about an isometric action where you're holding in place, that's not a big deal. But if the goal is motion, we do not want the antagonist to be active at all. The primary job of the antagonist is to stay relaxed. High-level athletes have the capacity to be able to easily transition from one muscle group to another and coordinated, challenging movements and actions at high speeds with great force production capacity, and basically can do so where an agonist fires, the antagonist is relaxed, and they can quickly switch over, and all of a sudden, next thing you know, now the antagonist is probably becoming the agonist and now doing the work. The muscle that's doing the work is the agonist. The one that's actually that would be normally doing the opposing direction is the antagonist. Okay, but we really don't want it to oppose. We really don't. If the motion is desired that's being performed by the agonist, we don't want the antagonist to do anything. Okay, if that's the goal. That's the question, isn't it? What's the goal? A synergist is a muscle that assists the agonist by contributing tension or stabilizing the point of origin, like acting as a fixator. Okay. Basically, we're talking about in situations where biceps brachii and brachialis muscle work synergistically to flex the elbow joint. They're working with one another. They're in assisting muscles that are not a prime mover. There's oftentimes some people referring to assistant movers versus synergists, but it's a little bit more tricky than that we're probably not going to spend too much time getting into from a standpoint. That's something more for a later, more advanced focus standpoint for synergists versus assistant movers, because there's some differentiating points there. So if you just notice an assisting muscle, that's not the primary mover, is the key factor here. So you should be able to define the difference between the proximal and distal attachment, or more specifically, if you're proximal and distal attachment from a standpoint of location, yes, what's more proximal versus what's more distal. However, make sure you also note the origin where it begins and the insertion point. Which muscle is stronger, a pennate muscle or a parallel muscle, or more capable of producing force based on its design? And what's the difference between an agonist and a synergist? For the next section, you should be able to list the 7 characteristics of muscles that may contribute to their names. Give examples of muscles whose names contain an indication of action, specific body region, attachments, orientation of muscle fibers, shape, size, and muscle heads. Now, muscles that are named according to several criteria. We have muscle action, where it indicates the muscle's primary function, like the flexor digitorum longus flexes the digits. The specific body regions indicate muscle location. The rectus femoris, femur, right? Femur is near the femur. It's actually technically pulling that lower leg upward into extension relative to the femur. Then we have muscle attachments that indicates origins and or insertions, like the sternocleidomastoid originates on the sternum and the clavicle and inserts on the mastoid process. So it says his name within it. And the orientation of muscle fibers, whereby a muscle's name indicates the organization of some muscle fascicles, like the rectus abdominis is composed of fibers that are running vertically straight rectus orientation. Okay. Muscle shape. The deltoid is shaped like a triangular delta symbol, hence the name. The abductor pollicis longus is a long muscle, longus. The muscle size, gluteus maximus, size larger, is as large as the buttocks muscles. You also have gluteus medius and gluteus minimus. By name, you can guess the size relatively to each other. Number of muscle heads in attachment site indicates the number of muscle bellies or heads each contains at the superior or proximal attachment site. And that's the triceps brachii, technically by triceps, has 3 heads. Okay, and we get into, of course, into function. Just because it has 3 heads doesn't mean it has 3 different functions. Don't confuse that. That has to do with more the origin and the insertion of the muscle. That's why you knowing there's more heads or more complex muscles in nature doesn't necessarily mean that the movement itself is going to be somehow different, or there's multiple capacity for moving more, or capacity for moving multiple bones or doing multiple functions. That has to do with the origin and insertion points. Clinical view, intramuscular injections. One route of medication administration here is it may be inserted into the muscle with a syringe. Medication in the cardiovascular system works through the muscle's blood vessels. It allows a large amount of medication given at once. It ensures slower and more uniform delivery than orally or intravenously. Like some vaccines, some contraceptive medications, some antibiotics. Common sites are the deltoid, the gluteal area, and the quadriceps. So what did you learn? What are some words used in muscle names that refer to muscle shape? The gluteus maximus muscle gets its name from which categories for naming muscles? We'll come back to section 3 here in just a moment.